represented by either.
That is really a beautiful, oh, I love this conversation. That is so important. We're actually making our children more vulnerable to disease by removing these natural protections.
And then finally, one last thing. I'm sorry to babble on about the video.
No.
I just wanted to also just touch on the forced retraction of little boys. The video talked about the foreskin being adhered to the head of the penis at birth for many boys, and that it shouldn't be forced back because boys need time to develop, and that is absolutely true. The point that the video did not make extremely clear is that the average age when boys can retract is roughly about 10 years old. Half of boys cannot retract their foreskin by 10. Some take many more years to develop. Some men can never retract their foreskin. This is a variation, a normal variation in male anatomy, and as long as it isn't causing pain or discomfort, that's fine. So if a boy who is 4 or 5 or 6 or 8 or 12 even cannot retract his foreskin, this is not necessarily a condition that can be diagnosed such as phimosis. This is just his body is developing at its own pace, and it should not be rushed. And certainly no one should be pushing back on a boy's foreskin but he himself. This would be as damaging and harmful as trying to open or tear open a girl's hymen to wash inside the vagina. You would never do this to a young child, to a young girl, and boys need to be respected and allowed to grow at their own pace in a similar manner.
Yeah, thank you for speaking about that, and I want to add to it because since I was born at home, I was spared the trauma of being circumcised, with my parents having no information, just going on their gut. But because I was the first intact male in my lineage, coming from a Jewish family, my mom didn't know any of what you just said. So I remember being probably 6 or 7 years old and at the pediatrician's office, and he said in front of me to my mom, his foreskin doesn't retract, it should, which is contrary to the facts.
Right.
And so he did forced retraction on me in that moment, so it looked very much like, it didn't look like the surgery, it was more like that scene where they're bathing. The person sort of gently pulls back in order to wash with the rag, only he was continuing to force it. So it was really painful, caused bleeding, and ultimately led to scar tissue, and caused a mild form of what you just mentioned, phimosis. So, I feel like part of why I care about this and want to be an advocate for people, having accurate information is that I was really traumatized, and that's why I began by saying I'm angry about the medicalization of this. He charged my mom money for harming me, and my mom, paid him for that privilege. And then, just like it says in the video, the instructions from my mom was to have, I was old enough at that age to do it, but I repeated the trauma every day, for months. And so, just so everybody knows, in case this happens, right? Sometimes you go to the hospital or the doctor's office and this will happen. If you talk to anybody where this has happened, the proper instruction is, just what Dr. Spock said, leave the baby's penis alone, or the boy, stop touching it, let it heal on its own.
Just to take that one step further, Elon, it's very important not only for medical situations, but baby care, for the babysitter, for the grandparents, aunts, uncles, when you take them to preschool, people all over need to be educated that, because so many people are in charge of your child, and every one of them needs to know unequivocally, never ever do this to my child. I've seen people have shirts, do not retract my foreskin. So there's no question, because a lot of people, particularly medical people, not just doctors, but nurses and medical people, this is what they've been told. Some of them can be a bit arrogant, and they dismiss what you tell them, and sometimes you just have to be very, very unequivocal. Of course, it depends on the person you're dealing with, but they have to be made to understand why not to do this. And most people, of course, are appreciative of getting this information, but sometimes you just have to make sure that this doesn't happen to your child.
So much of it is about just the elevation of our culture and the culture's thinking. And one of the things I want to point out, in a culture where, 3 out of 5 women have been abused, we have to really be watchful of how we have a blind eye when things are happening to our little boy kids. And this issue with penises and how we get sucked into thinking that such for our children to undergo, you know. So, did you want to speak?
I want to speak just on that. I wasn't able to watch it. You know, I sat here, but I couldn't look at that. And you know, I just hearing the baby scream and scream and scream and scream and scream. There's this idea that, oh, babies cry, that's what they do, you know, and then there's this other whole school of thought where it's like, baby's crying because something's wrong, you know, so like this isn't necessary to do, so why?
Exactly.
Would you just screaming and screaming and screaming
and
it's
that
not because,
scream.
right,
Particularly that
There's different screams.
right, exactly.
I've
never heard it's not like the baby. Right, yeah, and it's not like the baby broke his arm and they're trying to reset it and help the baby. It's like they're doing a completely unnecessary procedure, and you know the baby's just going and going, and I hate that, and that's just what I see as like intertwined is this sort of idea of like, oh, babies just cry it out, you know, that's, you know what I'm saying, that's just what they do, they won't remember, they're so young, you know, all these sort of things, and something in there is going on that's gonna be brought along with that baby boy for the rest of his life, and we're not acknowledging that,
and it's really important. It's important to call it what it is, which is it's a molestation.
Right.
This is a sexual violation of a human being. I mean, that's why it's hard. That's why we need to breathe. When we watch that video, we just watched a child get molested. That's what happened.
right, and so it's not just the physical trauma, but there's an emotional trauma, and no matter how young they are, that stuff carries over throughout their life.
And the root chakra, this is like the root of this little boy. So yeah, and for me as a person who is a counselor and who helps people deal with trauma, going back to that cry, that's the cry you never want to have a baby make. That cry where their jaw shivers. As a mama, you never want to get that far, ever, in a baby's crying. That's, you know that baby's in trauma land.
Yes, yeah, I want to speak to that because I was noting all the way through that that cry was totally different than the standard cry, like when a baby wakes up and maybe the mom's not in the room, and you're just like, where are you? Or that, I mean, there's a standard cry that we all know, which is what I expected to be hearing, but it was different. It was like the baby was kind of holding its breath and just, like it was
This
a
little
totally
one was completely terrified.
And I've
what
never
happened?
seen it.
Yeah.
And I've been around a lot of babies, so does that
And you know, when we're teaching parents to do attachment parenting, in this culture, we have an acceptance of crying that's too much.
That's what I was
Really, the
trying to
human
get. That's what I
baby
was
should
trying to
almost
get.
never cry.
Right.
The baby should never cry.
Yeah.
Crying is the last resort. Crying is like, Mommy, I'm trying to tell you for the past 20 minutes that I need something, and then I'm going to be in full-blown cry. So we're trying to teach mamas as attachment parenting educators to be mindful of the baby's cues so that the baby never has to cry.
Right.
This
You
is
don't
a,
ever want
this
it
is
to
a
get
fire alarm,
escalated
what the
to
baby's
that
doing
point.
there.
Yeah.
You know, and I point out, because the video did not, that what we saw, that scissors cutting into live baby flesh, that was no anesthetic.
Yeah.
That, I mean, it's important for us to feel the horror of that, really. It was no anesthetic. That was, how could any,
It's hard to control the doses.
That's what they
small.
say.
Yeah,
Even if you're
The only
For
way
adults,
to
it's even-
completely resolve pain is to give general anesthesia. It kills children. You cannot do that to
To
an
babies.
child.
Yeah.
We had a child in Midtown Manhattan hospital in recognition probably of the excruciating pain that male infants suffer. He was, Coleman was the last name, I forget. Jamal Coleman, yes. He was given general anesthetic and he died from the anesthetic. What they do is they will give sometimes, and it's very rare that they give any anesthetic because they don't work, they will give a topical anesthetic, which is not recommended. Emlyn, it's not recommended for that purpose for mucosal tissue, or they will give an injection. Can you imagine what it feels like getting an injection into your penis, and they have no way of knowing how it works, if it works at all. It just makes the doctor feel better, maybe, but most of the times no anesthetic is used whatsoever.
And it's also important to know that just because the baby's quiet doesn't mean it doesn't feel pain.
It's
The
a
baby
shock.
can numb out. Babies go unconscious. Babies just zone out and stare off into space. It doesn't mean that they don't feel, you know, that they're just further being damaged. So,
And there's also the pain for the week or two of follow-up
And
healing.
then healing.
You've got a raw open wound in a diaper with feces that is getting pressure on it during breastfeeding, pressure on it when the diaper's put on.
Getting doused with urine, which is
You get
very
stinging.
painful.
So
Yeah.
that pain
Sting.
is also not usually addressed.
Not at all.
So it's important for our young birth workers in training in the room to kind of to get that. And it just because it looks like, just because it looks like the baby's peacefully sleeping, like children being traumatized watching a TV program, parents think, oh, they're fine, they're just sitting there staring. No, your kid is numb and staring, and it can't move itself anymore because it's just like hypnotized and being programmed with whatever misery is being pumped into it from the TV. This poor child's body is struggling, this poor little circumcised boy, his body is now struggling to deal with this intense human load of pain. Like getting stabbed with a knife, you're a grown-up, and you're standing there trying to deal with it. You could stand there actually kind of calm as you die, and then that happens. You get shot in the stomach, kind of sit down peacefully. You don't flip around, you just die. And then we look at the greater issues in our culture with violence and sexual dysfunction and all the other things that are going on, and we don't draw out, there's so many things, like in how babies are born in this culture. We look at the illnesses and issues that children have. This is how we process them, because this country likes to process everything, like our poor farm animals and everything else. Like we don't see the correlation between the violence in our culture and how children are born violently. Just how a normal birth in the hospital is an incredibly violent event.
That's exactly what I was thinking when you were saying 3 in 5 women are victims, you know, and where's the connection there? Is there a connection there? Has anybody even explored that? The fact that we do from birth some sort of trauma to the male genitals, and then later in life, you know, 3 out of 5 women end up the victims of, you know, is there a, we don't know, but I mean, it seems to make some sort of sense,
If you have common sense, sometimes you don't need a longitudinal study.
Exactly,
Sometimes it's just like our common sense.
Right.
Like, look at what happens, and then you look at the issues with little girls.
There's a very good quote that kind of sums that up in a nutshell. What you do to children, they will do to society.
Yeah.
Absolutely. So I wanted to make room for folks who have not spoken to have a voice before we move on to our speaker and our other things.
I wasn't here to watch all of it, but the part that I did turn around and see them start to snip. And right around that time, Ari came and jumped in my arms, and he was circumcised at his bris at 8 days old, because his father was very, very religious and wanted it to happen, because he was not able to have a circumcision when he was living in Russia, because they had to pretend that they weren't Jewish, they had to hide their Judaism. So it was a huge deal. He was like, absolutely, we need to. This is not. It wasn't a question. He paid for it to happen. He paid for somebody to fly in from LA. But as the baby was crying, Ari jumped on my back. He wasn't fussing or anything. He just jumped on these, and I'm wondering if he has any memory of that cry or any of that. And that's when it was happening, when he was getting his bris. I wasn't here. And where it was happening, I had to walk away because I didn't know. I was in another part of the place. So I was closing my ears, I couldn't be around it, like just, and everybody gathered around because it's a huge ceremony, right? Everybody, all the boys in our family, whose families had it done, and it's a huge deal, and all the families there. And I had 2 friends that I worked with, and they were actually just, they were like calming me, they were like just rubbing my back, and while I hid far, far away from whatever was happening. And and then I saw a picture, because it was, they videotaped it, and there's a picture, and, of the rabbi picking him up and pulling him after, which is consoling a little bit, but obviously the trauma is still very, very, very real. But he was holding him and just shaking and rocking him, and Ari just kind of let out a really big burp because he was caught. So, you know, they thought maybe he just had a lot of gas, and that's what was happening. Or, you know, he was being cut. But, so yeah, so it's hard for me to hear those cries and then have Ari jump on me and then like feeling his memory of that and how, you know, we were having to treat his wound, and keep it, you know, like dress it every day and do all this stuff that I didn't want to use. And like a natural, I consider myself a natural parent, but I'm using all this chemical stuff to make sure that it doesn't get any infection or what have you. So yeah, it was.
Can I make a comment to you?
Not right now, please. Not right now.
That would be helpful?
Not right now.
All right.
I want to really show appreciation for you to say that when we're talking about this topic. And I really want to give you a moment as a mother just to sit with what you share in a public venue. So actually what I would like to do is to have us just take a little break, and then we'll go forward. We'll have a question and answer time soon, and then we can do more back with each other. And Lloyd, I definitely want to